Well, welcome back to Community Connections. I'm your host, Loran Graham, and this show is all about highlighting the great things that nonprofits are doing in the Spokane community. And today I have the honor of having as a guest on the show, Amy Vega, Executive Director of Vanessa Behan. So welcome, Amy.
Thanks, Lauren. Great to be here.
Awesome. So for somebody that's new to Vanessa Behan, they've never heard the story, how would you describe it?
Yeah, it's a really hard thing to kind of just sum up in a sentence or two, but we're all about keeping kids safe and building strong families. And I think the best way to kind of describe who we are is to tell the story of how we came to be. And our story really starts with a 2-year-old named Vanessa K. Behan, who unfortunately died of child abuse-related injuries when she was just 2 years old. There was a gentleman in our town who watched this kind of play out in the news. This young child had died in her home at the hands of one of her parents. And as he was watching this play out, he felt like he didn't want to live in a community where he was raising his young children at the time, that something like this happened and nothing was done about it. And so he really thought at the time he'd start volunteering in some kind of a nonprofit that was focused on the prevention of child abuse and neglect. And this was back in 1982 when Vanessa died. And so there really wasn't a lot of prevention work happening. And so as he traveled around the country as a businessman, he wasn't even in the nonprofit world, he came across this idea of a crisis nursery and felt like that was the right fit for Spokane. Came back looking for a crisis nursery and of course didn't find one. And so as every good wife will do, she said, then do something about it, start one. And so Bill did. He started the crisis nursery named in honor of Vanessa Behan. And the idea is really just a place for parents anytime they're overwhelmed with parenting or they have something that conflicts with their ability to care for their children, that they have a place 24 hours a day, 7 days a week where they can bring their children and we can care for them and we can help support those parents through whatever is going on in their lives to alleviate whatever stress or difficulties they're facing. And so when they come back together to pick up their children, that the stress is gone.
Wow, so really filling a really important role and tragic story that from the beginnings, but also just what you said, keeping children safe, and what was the second?
And building strong families.
Building strong families. Yeah, that's a powerful thing. So, and you've been involved for a very long time. I know in your current role as executive director. Tell me how you came to be involved and your journey.
Lauren, it's all about stories, right? So I did my undergraduate work at the University of Montana in Missoula, and my supervisor in my practicum actually had been one of the first counselors at Vanessa Behan, and so she had talked about it. And so when I graduated from my undergraduate and moved to Spokane, I thought, and I saw an ad for Vanessa Behan, I thought that must be where all social workers go. So I applied for a job and was hired. And at the time, I'm like, I didn't really know what I was going to be doing. And on that first day in the job, I kind of had my epiphany of the fact that you're caring for kids. Like, this is about children who are at risk or who just need that extra support system for their parents. And so I started off working graveyards with our kids 25 years ago. I did that for a couple of years and absolutely loved what I did, but I had an experience fairly quickly in my work there that prompted me to go on and get my master's degree because I knew that Vanessa Behan was going to be in my blood and I wouldn't be leaving anytime soon. So we had a mom who had called for the first time, never used our services before, and of course very nervous and apprehensive about calling a crisis nursery and asking for help. That's kind of a scary thing to do.
Right.
I think our society has this philosophy that you pull yourself up by your bootstraps and you just hunker down and get going, and it's all going to be easy from there. And the reality is it's not. So this mom who had a 4-year-old and never used us called, and not only was she overwhelmed, he was autistic, severely autistic, and so she was worried about our ability to care for him. And so we just said, just come to our doors and let us sit down and visit with you, and then we'll see where we go from there. And of course, she showed up, and you could just see it all over her face, that apprehension, that nervousness. And because we didn't have any kids at the nursery for that day, I have no idea why that was. But when she got there, we had no kids. And so we just said, you know what, we don't have to worry about confidentiality. So just come into our playroom, stay as long as you need to, watch our interactions with your son. And when you feel comfortable, then feel free to go and come back at the agreed upon time. And so she did. And we thought, half hour, 45 minutes of playing with him might be enough for her to say, good enough. And she did not. She stayed for 4 hours. And we learned more about this mom and this situation. And it really opened my eyes to what we do at Vanessa Behan. It's not just about caring for kids. It's the whole picture, right? You can't separate kids from their parents. If we want kids to be safe, then you have to invest in the parents as well. And so this mom stayed, and she shared a couple of things with me that I thought heartbreaking, in the fact that she said, I just don't know if I'm the right mom for him. And I think now, at the time I wasn't a mother, but now as a mother, I think how heart-wrenching to have to think it was that you would share that with a complete stranger. That's got to be, you got to be pretty desperate to be in that place. And she also said she'd never had a break from this little boy. And I never thought to ask if that was because nobody ever offered or she just didn't trust anybody. But he's 4 and she's never had a break from him. And I think, again, as a mother, how overwhelming that must be to not have had a break. And so at the end of the 4 hours, she's like, you know what, we're good. I'm going to take him. We're going to go home. And we just said, great. Now that you know who we are and how we work, feel free to call us back anytime. And sure enough, a couple months later, she called back, and I happened to be the one that got to sit down and do her kind of intake paperwork with her. And she said, I want you to know that first night when I called you guys and brought him in, my intent was to leave him with you and to commit suicide. Because she was so overwhelmed as a parent, not feeling like she was the right mother for him. And that was my turning point in the fact that not only do we do good work for kids, but you never know the moment you are going to have a profound impact on a child or a parent. And this was one of those moments. And immediately I went back and got my master's degree and said, whatever more I can do for Vanessa Behan, I'm in. And so I worked as a program director, took the job as the executive director, and I still feel just as passionate now as I did back then about the work that we do for children and families in this community.
That's amazing. I brought a little bit of a tear to my eye. That just to hear that story is so powerful.
Yeah.
And it's a delicate balance, because under the right conditions, under the right circumstances and chain of events, that people can reach that point of desperation that they never thought they'd be in. It's probably, you said that she didn't want to feel judged for bringing your child there, and there's this delicate balance of you mentioned at the very beginning, you're preventing child abuse as a goal,
right?
But then also showing compassion to these families, that hey, we're here as a service to you, and to really support that family, and to do that. And Vanessa Behan just seems to just have mastered just that delicate balance to just really show that compassion toward families, and also fulfill that mission of
parenting is so hard. I know you know that, and so many people in the
Absolutely.
community do. And I love that you say it's a fine line, right? Because this mom who brought her autistic child to us was not in a position where she was going to abuse him. So we weren't necessarily preventing child abuse and neglect in that moment.
Right.
We were supporting this family
Right.
in a much different way. And so I think that's one of the biggest message I hope people get in this community, is that it's not about those parents. It's not about those poor kids who are abused and neglected. It's about that prevention, and that is a very fine line. And I think we can all remember a moment or a time where we were kind of at our wits' end and didn't know what to do, and just thought, I can see how clearly that can happen. Now, most of us have the ability to step back and take a breath and have a support system that can help us. But if you don't have that support system, where do you turn? And that's when Vanessa Behan becomes such a great option in this community.
Right, and has been such an anchor for so many people. In fact, for so many people that I understand that you outgrew your old space, and have been able to transition to a new location. So tell us about that and what that's been like.
We are so blessed to have this community of support that allowed us to build a new facility. Our last home, so this is our 3rd facility, our last home we completely outgrew. We simply couldn't have taken another child no matter how much funding we got. And so we went on this journey of saying, if we're going to grow, what does that look like? Do we continue what we're doing? Are there other unmet needs? And so we really did this a needs assessment in our community and said, we don't want to reinvent what somebody else is doing. We don't want to duplicate anything. We also want to stay in our lane. Like, we know our priorities are children and families, and so we didn't want to go beyond that. But in that context, what else is out there that needs to be done? And so we've added some new programs. We've extended our age. We have primarily for years only done birth through 6, but we know there's a huge gap in Spokane from that 7 to 12 age range, and no timing better than the present, when we moved into our facility and the pandemic hit and all of a sudden schools were shut down. We saw an influx of that need for children 7 to 12, so we were able to accommodate that. And so not only can we take 3 times the amount of children, or we will be able to take 3 times the amount of children when we can raise enough money to do that, we're also taking older children. We are now partnering with other organizations to come in and do parenting classes in our space. We know we aren't the experts on everything parenting related, and that we've got a great community of support out there doing amazing parenting education. And so we've invited them into our space to say, we've got the room, but we can also provide the free childcare, which is oftentimes a huge barrier for parents to take a parent education class. And then we've also added some space where we can bring in other organizations to provide their services within our walls, so that we call it much more of a gentle handoff. So when a family comes to us and says, I need counseling or I need some housing assistance, we can just walk them down the hallway and introduce them to these other organizations that will be in our building here shortly. And so we're just really looking again at how we can be a good partner in our community and do the kind of work that we're called to do.
That's amazing, and that's so indicative of Spokane that, and it seems that there's something special about Spokane and the nonprofit community, that there's this large degree of collaboration that you don't find necessarily in other communities. And so it's just to hear that you're partnering and figuring out how you can fit together with like-minded organizations that maybe serve in a slightly different area, but it's complementary to what you're doing. That's awesome. So
yep, and exactly. We just don't want to become the experts when we already have those experts in our community, if we just provide them the space.
Sure, absolutely.
Yeah.
So, so you mentioned funding. How does Vanessa Behan find its funding?
Yeah, we are very, very fortunate. Bill, when he started us, was very passionate that if this was going to work, it was going to be because Spokane wrapped their arms around us and said, we've got this. And so we don't, we're 100% fueled by this community. We don't take state or federal funding, and this community has really rallied around us to allow us to do our work, to build our new home, and to live in that. And so, again, we do that through events and through relationships with people who really are making an investment, right? I think you, of all people, would understand that there's a return on that investment, and that return in our community is healthy children and strong families.
That's wonderful. That's wonderful. So, when you moved, I understand that you also went through a rebranding process, so sort of a chance to have for introspection and to redefine, who you are and what you're doing. And tell me about what that process was like and how you landed at the new brand.
Right.
Yeah.
So we did is we kind of did this needs assessment and started asking people in the community what they know of us, what they think of us, what we need to know, how do we make some decisions about going forward, what we need to be doing. We heard a lot of people say that the words crisis and nursery in our name really kind of added some stigma to our parents. We had people say, I would never call you because I wasn't in a crisis in that situation. I think about and we see that in our headlines too. We've had a couple of deaths in our community lately of children. One from a mom who went to work. You wouldn't think of leaving your child with somebody you know and love and trust as a crisis. You would think of you're going to work. And so we felt like we needed to really take that word crisis out of our name, because we pride ourselves on being non-judgmental, and yet with that word in our name, we felt like now we're promoting judgment of who's going to decide whether your crisis is worthy enough of using our services. And so we just dropped that completely. And then nursery, we will always be a crisis nursery. That's kind of the model that we use. But nursery also, I think, implies young children. And now that we're taking children up to the age of 12, we just don't want to add that barrier for families in using our services by having those names. We have enough brand equity. We've been in this community long enough that most people understand who Vanessa Behan is. Or now with technology, it's so easy just to find that information.
Absolutely, yeah, just to search online and
You
there
got
it is.
it.
Yeah. So removing the name crisis sort of helped with that, walking that fine line we were talking about earlier, that just, showing honor and compassion to these families that want to use your service and that would maybe feel more open to calling. And then removing the name nursery, because you are serving these older children, but they're not quite old enough to be home alone, and so that fills a gap there. And
You got it.
But we're all going to remember the diaper drives is kind of one of the staple things about Vanessa Behan. So so you do a lot of events and drives and things. So tell us about some of the things that you're doing there.
And that's probably how a lot of people hear our name in the community, is through the events that we do. And that's, again, when you talk about the way we are funded, it requires all of these events to make that happen. And so we've got, yeah, like you said, we've got the diaper drive that we partner with Rosars and Creme to make sure that we have diapers. We give out 250,000 diapers every single year, and that's giving those out to the community. There's a huge need for diapers. They're expensive, and especially in this time where we've got a lot of people who are unemployed and having a hard time finding work. It's really helpful for us to be able to give out diapers. And so, yeah, that's one of the big things that we do. Probably our biggest fundraising event is our luncheon that we do in June every year. And that really is just, we try to bring in our mission to everything we do. So we have a family who will come and share their story at our luncheon, and just let people understand, when you support Vanessa Behan, these are the families and the children that you are making a difference for. But we do everything from, our luncheon to a beer pairing to a black tie event. We've kind of got it all wrapped in there just to find a way to raise that money. But I will say probably the best thing that we can do is build a relationship, just like we do with our children and our families, is build a relationship with those people who are supporting us. And so really, we love to have people come up and see firsthand the impact that we're having, and then invite them to invest and be a part of our circle of people who are making this work happen. It allows us, again, to just build that relationship. But again, when you make an investment, you want to know where that money is going and how it's being used. And the best way to do that is, again, to see it in action and to build a relationship and ask all those hard questions that people have about where their funds will go.
Sure. So people can actually come to the I want to say the nursery, but
You can. You absolutely can. We still do that.
To come to Vanessa Behan and see what it's all about, and get
Yeah.
a tour, and then if they wanted to partner, as a kind of a regular recurring type of thing, that they could do that. So
Exactly.
Yeah,
And I would say, don't just show up, but give us a call and we can coordinate a time for somebody to come and do that.
you're right.
Yeah.
Good call. Right. So obviously this year, I think it's fair to say that everyone's world was turned upside down in some form. You'd mentioned that
Yeah.
you saw an increase in demand for your services. Working single parents were trying to figure things out. With their young children, young children. How would you describe? I mean,
Yeah.
just the experience of so certain events. We weren't able to do, but then now we
Right.
can. But
We've done a lot of virtual events, that's for sure, and I think we're all burnt out, but I think that's going to be our reality for a while. I think that one of the saving graces for us is that we are used to living in kind of a crisis mode. Like we're adapting all the time to what our families are coming to us with, the combinations of kids that we have, because we just have kids come on a daily basis. We don't know that they're coming every day. So we're always adapting all the time. And so when the pandemic hit, we were pretty used to doing that, like adjusting in the storm. But I got to say, it was a little overwhelming because nobody's ever been through this before. And every day information was changing. And our main goal was keep our doors open, keep that virus out so we don't have to shut down and turn families away, because we know that they needed us now more than ever. And I'm so grateful to say that we were able to do that. We never had to close our doors. We were open from the second the pandemic hit. The second that the governor shut down schools, we were still running full bore. We had some tough days where we had staff out for testing. We've had some tough days where we've had to turn families away because of some risk factors of exposures. But I think we're all starting to feel like our feet are back underneath us. And as we head into another wave of this, that we're confident that we can do this. We know how to do it. It's not easy, but we've got the team that's there to make it happen.
Yeah, that's awesome. That's awesome. So I would envision, only the need for your services increasing as time goes on. So you've got your new location. How have you planned for, future growth? Like what is the vision as you look down the road for Vanessa Behan? What do you see?
Right. So we've got this brand new facility, and it's designed to take 3 times the amount of children that we were serving in our old facility. We're slowly eking that number up. We're not quite there. That would be 60 kiddos. As we get closer to that 60 number, I really think our building can handle more. So we'll start working with the fire marshals and our licensors to make sure we can increase that number. But we've also been looking at how do we continue to grow? When we outgrew our last space. It took us about 7 years to find our home that we're in now, and we never want to be in that position again. And so maybe a little premature, but we saw the property adjacent to us go up for sale. And so we made the tough decision to pull some of our money out of reserves and put it into that property, with the realization that it takes us about 10 to 15 years before we outgrow our space, and we will need more. While we can add on to the building we're in now, that would take up all of our parking, and we would have nowhere else to go. And so our long-term goal is that adjacent property will be for us to eventually build on and continue to grow our services. But in the short term, we've got this great partnership with Family Promise, who is just in the process of moving in to that space to lease it, so that it still becomes an investment tool for us, because we will make some money off of that lease. Not a ton. The goal is not to make it difficult for a nonprofit to be in there, but again, to return the investment that we were making on that money when it was in an investment tool for us. And so it allows us to then have that long-term growth, but also have this partnership with Family Promise, and have this area of Sprague that we're at have a lot of services right there for families, so that as people who are dealing with homelessness and housing insecurity, and they're working with Family Promise, we can be a support to them and their children if necessary. So lots of great opportunities, but there's just so much potential growth out there, and we will continue to adapt like we always do to the needs of our community. We get lots of feedback from our families that help us adjust our programs accordingly, and we have done that many times, and so I see that continuing.
That's awesome. So you had mentioned earlier, when you give the tour, that you want to encourage or reassure people that their funds are being stewarded well. And I know planning for the future is a big part of that. Good stewardship and making sure it's done in a way that's, from even though you're a nonprofit, in a way that's business savvy, and all that. So it sounds like that was a cool opportunity. So awesome. So in the few minutes that we have left, is there anything else that you would just want the Spokane community to know about Vanessa? Or if somebody wanted to get involved, what would you say to them?
We use volunteers. We are hiring all the time, so please come get involved. I think a couple of things that I would say is that we're a pretty unique organization. There's not a lot of crisis nurseries across the country. We're one of about 100 in the entire United States. I think we are the only one, especially that operates the way we do in the state of Washington. So Spokane should be really proud that we have this organization. They should be very proud of the investment that they're making in allowing us to be as strong as we are. We get called all the time about how do you start a crisis nursery, how do you replicate your model, and especially how do you do it with private funding. And so we've kind of become this model organization, and I think that's pretty cool to say that happens in Spokane. So this doesn't happen because of a leader, this doesn't happen because of a team, it happens because of an entire community that says, we believe in the work that's happening there, we're going to wrap our arms around this and make it happen. And I think the most important piece that we do is we do that in a non-judgmental way, that we want anybody who's feeling overwhelmed, who has insecurity about where their children are going to go, doesn't trust their caregiver, or isn't sure about it, to call us. We're there for people who just simply need a break, who has a brand new baby and hasn't slept in a couple of days, who have to go to work and don't know where to take their child, who had a death in the family, who is just overwhelmed with children, or the loss of a job, or illness. So we're there for anybody. Just pick up the phone and call.
Yeah, what a wonderful resource. So, Amy, thank you so much for spending time with us today. And that's all the time we have for today. Thank you for joining us for Community Connections. We'll see you next time. Managing finances can be complex. At Loran Graham Company, we're a team of certified financial planners helping clients pursue financial freedom in retirement, live generously, and seek to make a positive impact in the world through faith-based investing.
Loran Graham, CEO and President, is an LPL financial advisor. He's also a published author and nationally recognized leader in the field of faith-based investing.
Visit our website today at lorangraham.com to request an initial consult at no cost or future obligation, and learn how you can become part of a growing movement of investors who want to align their investments with biblical values.